Ladies and gentlemen, good evening. Am I audible enough? Please, can we hear me?
Yes, we can hear you.
All right, everyone. Good evening. Uh, Welcome to the Professional Development and Mentorship Program organized by the African Radiography Scholars and Professional Network. This is the Pioneer Core 2026 and our second section in the Global Mobility Track. Today, we'll be talking about navigating the Health and Care Profession Council, the widely known HCPC pathway. And tonight with us, we have our speaker, Mr. Nnemeka C. Ugu. Mr. Nnemeka is a purpose-driven and goal-oriented radiographer with over a decade of clinical experience and deep expertise in advanced medical imaging, leadership, mentorship, and service transformation. His career reflects a consistent commitment to excellence, innovation, and development in people, system, and healthcare. He graduated from the University of Nigeria Enugu campus and served as the president of UNRASA during his tenure. During his tenure, he led a significant rebranding and strengthening of the association, successfully delivering key performance indicators that elevated its visibility and impact. Before relocating to England, Mr. Nnemeka lived in Lagos, working across several hospitals as a radiographer and serving as a CT clinical application trainer for Siemens, where he contributed to workforce capability building and clinical optimization. Mr. Nnemeka is actively involved in professional leadership and advisory work across multiple organizations and currently serves as the council member, Northern Region, for the Society of Radiographers. He is also the council representative on Society of Radiographers MRI Advisory Group, contributing to national MRI policy, safety, and workforce strategy. Mr. Nnemeka also serves as welfare chairman for the Nigerian radiographers in diaspora. He is also a member of the advisory board of Young Health Professional Community, where he supports mentorship, education, and technologically driven professional development. He also serves as a personal development mentor for the Consortium of Advancement of MRI Education and Research in Africa, known as Camera MRI Africa, a global network that is advancing high-value MRI access in Africa through training, research, and multidisciplinary collaboration. Mr. Nnemeka also holds qualification in leadership and health management and was recently awarded the prestigious Chartered Manager Fellow awarded by the Chartered Management Institute, recognizing his strategic leadership, impact, and commitment towards professional excellence. Finally, Mr. Nnemeka currently serves as a clinical lead MRI radiographer at Northfield Health Newcastle Hospital, where he leads MRI services, safety governance, quality improvement, and staff development within the high-performing clinical environment. Ladies and gentlemen, permit me to welcome our speaker for tonight, Mr. Nnemeka Ugu. Sir, you have the floor, sir.
Hello, everyone. Can you hear me? I suppose everyone can hear me. Thank you so much for that introduction, but in my opinion, that introduction was not necessary. First of all, I am your colleague, and I just want to be addressed as such. I am your colleague. I'm a radiographer, just like every other person here, except we have students here who are still not yet registered radiographers. Then I'll be your senior colleague. So I'm happy to be in the midst of my fellow radiographers. So first of all, I'll say thank you, Shijoke, for organizing this. It is something really very much needed, especially at this time, because I think radiography as a profession has really grown so much. When I was still a student, a couple of years ago, we only had 5 universities offering radiography in Nigeria, only 5. And just as at end of last year, when I was speaking with the registrar, well, the former registrar now, Professor KG, he did mention to me that we now have about almost 80 schools offering radiography. So we've come a long way. And, you know, radiography is such a small world, a small family. And I hope that everybody, you get to see that very soon, that you get to know, you know, if you see somebody working in your department, you surely will recognize 1 or 2 persons connected to that individual. So it's such a small world. And maybe in the future, who knows, some of you here, we might cross paths and get to work together. But I am very much happy to be here, and thank you so much for organizing this. I was asked to speak about, do you mind if I share my screen first of all? I can do that. Let me see. Just give me a second, please.
Yes, you can share your screen.
Right, just give me a sec. Right, you can see my screen, can't you? Yeah, so that's my screen. Great. So I was asked to share on this topic, navigating the HCPC pathway, global mobility track. You know, it's interesting because when I then went back to Chiji again, I said, are you sure you want me to talk about this? You know, only because HCPC is just one out of many other professional bodies that one can actually think about when it comes to radiography. And I will just explain that in a minute. But I wasn't sure also my audience, if my audience here are students who are yet to graduate, or radiographers who have graduated and then waiting to register for HCPC. Can I get a thumbs up if you're still a student? Don't worry if you're not a student, but if you're still a student, can I get a thumbs up? Just so I have an idea who we have in the house. Great. So I don't think we have a student in the house. So this is fantastic. I mean, it would also be nice if we still had students. But can I also ask if you have got your HCPC registration yet in the house? Anyone? And if you have not got your HCPC, just a thumbs up. Right. Okay. A lot of people have not got their HCPC registration. That's absolutely fine. So it just takes a step to start that. So first of all, I will just go straight into this conversation. We will talk about HCPC in detail, all you need to know about HCPC, and then we'll talk about other professional bodies that exist outside of the UK. I'm going to just put my video off so you can concentrate on the slides. Is that okay? Right. What is HCPC? Some of you may have heard the word HCPC. And if you're hearing it for the first time, it stands for Health and Care Professions Council. Okay, so, excuse me, in the UK, it is the body that actually regulates diagnostic radiographers, therapeutic radiographers, and 13 other health professions. So it's not just radiographers that do have HCPC registration. So registration for HCPC is required for, you know, physiotherapists, it's required for med lab scientists, it's also required for, you know, podiatrists and audiologists and things like that. You know, there are other professions, and we call ourselves allied health professions. So we are under allied health professions in the UK. The registration allows you to work legally in the UK. So if you do not have a HCP registration, there's just no way you can work in the UK. It's interesting because I do get this question a lot of times from people who are not registered radiographers, people who probably are in other professions, but then decide to come to the UK to study for their master's program in medical imaging. And then they ask me, can they practice in the UK afterwards? I'll come to that later on. But in a nutshell, it doesn't matter where you are, who you are, you know, HCPC is the only legally framework or regulatory body that allows you to work in the UK as a radiographer. This applies only to United Kingdom. There is a different one for Northern Ireland, which is called Koru, and we're not covering Koru today. But the UK, we have the other countries in the UK, Scotland, Wales, England, they are covered under HCPC. But the fourth one, Northern Ireland, it's not covered under HCPC. Right. We would have to then explore what it used to look like previously. When I registered as a HCPC radiographer in 2015, we didn't have some of these things now that they now require from new registrants. Previously, the assessment method was more of equivalent check only, you know, so you just submit all your documents and HCPC just looks at them. And if they wanted more information, they will come back to you and ask you to get through to your university, and then the department sends the required information that they need to them. Whereas now they've changed the method. So there is now an introduction of test of competence that was added. We never had to do OSCE exams. We never had to do MCQ exams. The documents required, they were really minimal. Verification checks, you know, nothing really complicated previously. English requirements, we never had any English requirement. We were only allowed to present an equivalent of, you know, a letter to say that we were taught in English, and that was just that. The processing time was just 3 to 4 months, and then we had the scrutiny fee, which was way, way, way lower than what it is today. It's either you get an approval or a refusal. Previously, you couldn't get a test of competence as it is now. The clinical scope was general radiography. Then they didn't expect us to have like advanced imaging technology technique or advanced imaging skills, MRI and CT. You know, once you knew your general radiography, they were absolutely fine to register you as a radiographer. And then when you get the job with either NHS or independent providers, that's the private organization, then they can train you in the required field that they prefer to train you. Excuse me. The governance standards, they had less emphasis there, but as of today, we have strong emphasis. Now, all of this happened just after 2024. After 2024, what was the situation? There was strong evidence to suggest that internationally trained radiographers were becoming prone to a lot of workplace mistakes. The level of expertise that they claimed that they had was actually very questionable. And now, this is not to say Nigerians. No, it is not just Nigerians. It is all international, internationally trained radiographers. So there is obviously strong evidence to support that. Now, it doesn't mean that everybody falls into that box. So the rise in workplace mistakes, people not following the clinical governance guidance, people not knowing what to do in certain scenarios, then raised the question about the processes and checks that HCPC would usually pass through. In fact, for sonographers, it has even become way more difficult. Previously, sonographers could come into the UK, of course, through HCPC, but also they would just have to present their PGD ultrasound done in Nigeria, and then it wouldn't be a problem. Whereas now, it has all changed, that if you're a sonographer internationally trained, you have to pass through what they call case accreditation. It is another form of PGD in the UK for you to be able to practice sonography in the UK. So all of this evidence was what the HCPC considered and then changed some of the guidance on how the registration would be post 2024. And since then, it has become even stricter. Now we're going to be looking at the core HCPC standards that you must meet. These are very important that you pay attention to them, because they are the things they look into or look at before they take anyone. And I'm just going to list them. First of all is standards of proficiency. The second one is standards of conduct. And the third one is standards of education and training. Now we go back to the first one, which is the big one. So the standards of proficiency, it will define exactly what a radiographer must be able to do to practice safely, okay? And just what we listed here, they are the examples that you have to demonstrate as a radiographer for you to be able to practice safely. You must be able to demonstrate that you understand justification of exposure under IMA. IMA is the regulation for ionizing regulation in the UK. It regulates how we expose people to ionizing radiation. It tells you what the standard dose or the diagnostic reference levels are. So in CT, it tells you, for instance, if you were to expose somebody for a brain CT, it tells you what the DLP, so that's the dose that you are exposing that brain to. It tells you what you must not exceed for an adult brain. Now, if you then exceed that, you are going against IMA exposure justification. I hope that makes sense. You must understand optimization of radiation dose. So this has to do with your parameters and how you manipulate your parameters to arrive at quality image. Some people would, go against this, and that is where the problem starts. A lot of people who have had HCPC related issues, they are all centered around wrong exposures or wrong radiation dose given to patients without them reporting it. In fact, when I used to practice in Nigeria, it was very customary for us to, radiographers, you could just perform a CT scan, and if you're not happy with that CT scan, you just repeat it. I mean, you just repeat it. But that can never happen here, because you need to justify why you are repeating an exam that you already performed, giving double radiation to a patient. Now, that is a very serious issue that needs to be reported. So you have to report that you've exposed this patient twice. Who authorized the second exposure? Why did you expose that? And a lot of people lose their license for simple mistakes like this. Now, you're not losing your license for repeating an exam. You're losing your license for trying to cover it up. You're losing your license for not following the guideline by reporting to somebody who was higher than you to authorize a second exposure. So this is what HCPC expects you to understand. Their standards of proficiency states that you should be able to demonstrate that you understand optimization of radiation dose. You should be able to demonstrate that you can communicate effectively. So communication is not, and I tell people this is not about accent, okay? As far as you have passed through the four walls of a university, you have stood before a lecturer to defend your project, you have stood before a lecturer to defend or talk about Viva or even make any presentation or seminar, whatever, you are able to communicate. Now, effective communication is to make sure that the next person understands you clearly in simple terms. It has nothing to do with accent. So when I see radiographers or even internationally trained medical professionals here who struggle to, oh, I have a problem with communication, oh, they don't like my accent. No, it is not about accent. It has nothing to do with accent. It is an articulate way of conversation where the next person understands what you are talking about. You have to be understood. If you are talking to somebody and they've not understood you, then communication has not taken place. When they misunderstand you, then that will be, it's going to be a wrong, there must have been a breakdown in communication somewhere for them to have misunderstood you. You should be able to know how to apply governance and safety. And when we talk about governance in medical imaging or in healthcare, we talk about clinical governance. Clinical governance has to do with understanding of audits. So this is something that we were not used to also in Nigeria. When I used to work in Nigeria, we were just used to coming to work, scanning and, just go home. But beyond pressing those buttons and scanning is your paperwork. It is your documentation. It is you making sure that the equipment you're using is in good order, is in a good working condition, that you are performing your QAs, you are reporting if there was any issues with the scanner, you are wiping down equipment properly and you're documenting that it's been done. Do you do the QA every once in a week or every morning if it is daily? Is there any evidence to show if I turn up as regulatory body, let's say RRBM turns up, or the other body that regulates radiation in Nigeria, if they turn up to your hospital and say, oh, can we see the document that demonstrates that you perform quality assurance of this scanner from 2 years till now? Are you able to demonstrate that? So that is clinical governance. Are you able to show that you maintain infection control policies within your workplace? Is there any document that shows that staff, they wash their hands regularly before they cannulate or after they cannulate? Is there any document that shows that staff are wiping down scanners after they perform individual scans? These are all governance. You need to understand how to apply that. And that is what HCPC is looking for. I don't want to rush this topic just in case some of you might be thinking, oh, can we just move to the next slide? No, this is why it is important for you to understand what they're looking for, why it is important for them, and how it can help you in case you are applying. Because obviously, like I said, we used to be 5 universities, and I know why I said that. But now we have about 80 universities. So that should tell you something. If 5 people used to apply for something and they get it very easily, imagine when there are 80 of them. And I hope you understand what I'm trying to say. So it's important that you understand the critical lines of what the expectation is from HCPC points of view. They want you to understand red lines, red flags. What are red flags? Is there any issue with this image? Have I done it properly? Is there something that needs to be flagged with the radiologist? Yesterday I did an MRI and it was a very quick lumbar spine MRI. And by the time I was done, I saw that this man's spine was really so bad. What happened was a case of cauda equina. And cauda equina is an emergency. if I had left that gentleman to go home and anything happened along the way, they will come back to me to say, well, you performed this scan. You should have seen that this gentleman had cardiac equina. It's an emergency. He could be paralyzed in the next 12 hours. So what did I do? I had to raise that with the radiologist, who then provided an immediate report. The man was wheeled to medical emergency department, where they now took him to see the consultant, you know. So you should be able to recognize red flags when you see them. You should be able to work autonomously. And HCPC does not want you to say that you know how to do CT when you don't know how to do CT. What they want you to do is to say, I am confident in performing X-ray. I can't do CT. I am not confident performing CT. They will understand that. But if you then say, I am confident performing CT, MRI, X-ray, whereas you have limited knowledge in those, well, they expect you to work autonomously if you have agreed that you know all of these modalities. And then when you now work autonomously and an issue arises, your license will be withdrawn because you clearly stated that you are competent in those modalities. So what am I saying? Do not claim that you know how to perform all modalities when you do not know how to perform all modalities. Only declare your proficiency in modalities that you are competent on. I am very competent in MRI. I'm competent in CT. I used to do X-ray many years ago when I was in Nigeria, but I've never ever done X-ray here in the UK. So am I competent in X-ray? No, I'm no more competent in X-ray. So I couldn't declare that to HCPC. I can't perform X-ray at the minute because, I mean, I've not done it in ages. Am I competent in nuclear medicine? No, I'm not going to declare that because I'm not. So the fact that you're a radiographer does not mean that you know everything. You should only declare what you're capable of doing. Okay. Now, moving forward, we have the standards number 2, which is standard of conduct, performance, and ethics. Here, what the HCPC is looking for is your confidentiality, is actually your professional behavior. They are going to be looking at your confidentiality, your consent, your safeguarding, duty of candor, professional boundaries. Okay. Before I go ahead, I'm just going to sort of allow us to come off speaker. I would like to engage 1 or 2 people, and I'm going to throw out a scenario-based question, and you know, anybody that is happy to come off mute and answer, I would like to hear. So, a nurse calls you while you are on night shift. Are we all listening? I just need a thumbs up if you're listening. Fantastic. Thank you, Chine. Thank you, Sarah. Thank you, Patience. All right, great. We're all together. A nurse calls you while you're on night shift and says, oh, Stanley. Sorry, Stanley, don't worry. I'm not calling you out. And says, oh, Stanley, the patient that you scanned just a few minutes ago, can you tell me what, the result is out, but we cannot see it. Can you tell me what the result is? Tell me what you can see on the screen. Just check. And then you look at the exam and you can see the patient's result. But is the nurse on the phone? The patient is there about to be wheeled into theater. What are you going to do in that situation? Is you alone in the department, and this is what has come to you on the phone? Anybody? There's no right or wrong answer. So don't feel shy. Just come off mute if you want to talk. Or do you want me to take the question again?
Yes. Yes, sir.
Yes. Do you want me to take the question again? Yeah?
Yes, sir. Yes, sir.
Okay. The question is, you are alone in the department, in your department, performing, MRI or CT, whatever, and then you receive a call from a nurse who is in the ward. And this nurse is asking for a patient's result because this patient was in your department for an MRI and they believe that the result is out. And you can see on your screen that the result is also out. But they are asking you to tell them what the result is on the phone because the patient was about to go to theater. And they are mounting so much pressure on you, asking you, please, can you tell us what you can see? So I'm asking, what are you going to do in that situation? What will be your response?
Okay. My response is going to be okay. First of all, good evening, everybody. My name is Stanley. So for if I was the person, or maybe if I'm in this situation, so what I would do is I will actually, I know is about saving life, but it's also endangering my own career. So I'll have to maybe tell them to refer them to the doctor that referred the patient for maybe explanation, and which giving the result is out of my jurisdiction. Thank you.
Thank you so much for your response, Stanley. And just so you know, I wasn't calling you out. I was just randomly calling names, okay? So don't feel like I called your name out. But thank you for your response. Does anybody have any contrary opinion? Any other answer to this? Right. So we all agree with Stanley that would be the right thing to do. Okay? Stanley has rightfully said that he will refer them to whoever requested for the imaging. It doesn't matter if heavens are falling. Confidentiality is something that is very, very, very critical in the NHS, in the UK entirely, not just the NHS, and it's not even just in healthcare. You couldn't just randomly take pictures of people and post it on your social media. If that person gets to see it, they can sue you because they're not giving you consent. So you need to get consent for some things, and consent was supposed to be the second thing we're talking about. But back to confidentiality, there's been a lot of radiographers who have lost their HCPC registration. In fact, I heard of one today, and it happened in my friend's hospital. What happened is a lady who has gone into this gentleman's patient's record, picked this patient's number, and she started calling the patient and making advances to this patient. And the patient's wife found out and called the hospital to say, a radiographer from your hospital has been speaking to my husband. I will need to know who this person is. Not just that, she went ahead to post the screenshots of their conversation on Facebook in the hospital's platform. So the radiographer has been long suspended, but these are confidentiality related issues that one can find themselves in. Apart from compromising the patient's result, where you're not supposed to actually share that on the phone, there are other things that could get you into trouble. If you were working in a hospital, obviously, you probably would be registered in that hospital as your primary place. If you were sick as a patient, not as a radiographer anymore. If you were sick in that hospital, you probably will be taken to that particular hospital for treatment. And sometimes radiographers who have access will think, oh, is my record? I can always just go into my record and see. Can I just quickly log in and check what the diagnosis is? And some people, they make this mistake thinking that it's okay. It's actually illegal for you to log in with your account and go into your own profile to look at your diagnosis, even though it was performed in your hospital. That is how serious it is. So people take these things very trivial until they get into trouble, and a lot of people have been struck off because of confidentiality issues. There are a lot of examples. Now, consent also, you need to understand what consent is. The fact that a patient has come to you for a CT or X-ray or whatever, and has said, yes, I would like to have this image, this imaging done, does not mean that they consent fully throughout the entire process. You might just be about to position the patient, and the patient says, you know what, I'm sorry, I can't do it anymore. And then they say, oh, but you've signed that you'll do it. Well, I'm changing my mind. There's nothing you can do. Okay, so you need to understand and respect people's choices and consent. They can refuse to have the treatment or the examination at any point in time, and that has to be respected. In fact, in MRI, when they say that to me, usually it's at the point of trying to put a coil over their face for a head scan, and they go, oh no, I'm sorry, I can't do this. My next question would be, are you claustrophobic? And they go, yeah, no, not really. I just don't want to do it anymore. Like, okay. I mean, I will explain why you need to do it. I'll give you the choices, but I'm not going to force you to do it. So I will usually say to them, it's your choice to have this imaging done. This is the reason your doctor has asked for it. It's important that you have it, but I'm not going to force you to have it. Or if you do not want to have it, just go back to your doctor, have a conversation, and see if there's any other alternative to have this imaging done. You must not force a patient. Safeguarding issue is also related to confidentiality and things like that, but safeguarding is more towards protecting people's characteristics. So if you were about to perform a chest X-ray, for instance, and you notice that the patient's back has some marks, let's say a female who has attended for an X-ray, and you can see that the back of that patient has like some marks, you can tell visibly that this is not just a normal, usual mark from an accident. It could be, it's probably something that must happen at home, maybe domestic violence. Now, safeguarding expects you, the radiographer, who has seen it, you must not keep quiet. You have to speak to the patient and say, could you tell me, please, what these marks on your skin, what they are? How did you sustain the marks? Is there anything you want to share with me? And you question further to find out why those marks are there. And if your suspicions are right, you must then escalate it to safeguarding lead. That patient must not leave your department without you escalating it. So you see, your work is not just to take images. You are saving somebody else's life. In fact, it's a very tricky position because there's a bit of psychology here, and you have to put it into practice. I had one recently. The patient came for a CT scan, and the man who she was living with also came with her. It was the man that drove her to the department. Okay, so the man brought her in. They both sat in the waiting area, and when we took her for CT scan, she then began to talk to my colleague about how the man was abusing her, how she didn't want to go back with the man. And my colleague just came to me. Obviously, I was it was my previous job, so I was the MRI lead, and I was also the safeguarding lead for the hospital at the time. So they told me the story, and I said to them, we must not let this woman go. I'm going to speak with the woman, and then we had to protect the woman, give her a separate room to stay, and all of that. But what happened was, while we were trying to speak with the woman, she changed her mind and said, oh, you know what? She's no more interested. Nobody should do anything on her behalf. She's fine. Let's pretend this never happened. This conversation never happened. But well, you have told us the situation. You've told us the story. There's no way we can pretend it never happened. So what we did was we had to follow all the pathways. We said, look, for the fact that you have told us this is what we're going to do. We're going to contact the council and let them know that you're being abused, and this is what you have told us. Because if that patient goes home and the patient dies or sustains more injury or whatever, then they can turn around and say, well, we told the radiographer when we had a CT scan that this was happening. Okay, you, the radiographer, they will come back to you in the court of law. They will ask you, what did you do in that situation? So this is a very, very serious issue. You need to understand that part of conduct, standards of conduct. Duty of candor. Can any other person tell me what they understand by duty of candor? Anybody? Or if you have not heard the word before, has anybody ever heard the word duty of candor? Okay, don't worry, I'm just going to explain it.
I have.
So, hello, who is speaking? Is that Chineye?
Yes. Hello, everyone. Good evening.
Hi, good evening.
My name is Chineye. So I know that duty of candor means when you've made a mistake, you owe the patient. It's your duty to the patient. Okay. That's what I think. Thank you.
Fantastic. Fantastic. One glass of Ragolis water for Chineye. That's a very good explanation of what duty of candor is. Duty of candor is basically taking responsibility for your actions and then being open and honest about it. So if something has happened, has gone wrong in the course of your duty, it is not the end of the world. I mean, you're human at the end of the day, but it is also your duty to let that patient know if it actually involves the patient. If it does not involve the patient, there's no point telling them. But if you were, say, for instance, you were injecting contrast and then there is extravasation, now it involves the patient. You are going to do one or two things in that situation. You are probably going to recannulate the patient and give another injection. You are probably going to then perform maybe non-contrast, or you're probably going to say, well, you know, the images are fine, but it's suboptimal and we're not repeating the exam. These are like, you know, probabilities that might come out of that situation. But you don't just make that decision and move on. You have to involve the patient. You have to tell the patient, okay? You have to explain to the patient, sorry, ma'am, we've had a situation. The contrast did not go in as expected. The line wasn't really as patent as we expected it to be, and this has happened. Are you happy for us to recannulate you? That is duty of candor, okay? And then you go ahead to say, we're also going to report this as an incident that has happened, you know, because if something has gone wrong, you should report it. And then professional boundaries is looking at your understanding of, you know, how you interact with your colleagues, how you do not like share work conversations to, you know, on social media, or you do not disrespect your colleagues and things like that. So it's just how you maintain professional boundaries. Don't do CT when you are not qualified to do CT. Don't do X-ray when you are not competent in doing X-ray. If you haven't been signed off to use a particular equipment in your hospital, do not use it until you're competent. Because if you make a mistake, they'll come back to say, have you been signed off? Who signed you off? The last standards that HCPC expects, which was recently introduced, it wasn't recently introduced, but some parts of it were actually modified, is the standard of education and training. So they just expect you to have your qualification, and they check it against the UK qualification or standards. They will look at the curriculum and everything, and then they will decide if they are going to issue that HCPC to you or not. Now, in a nutshell, all of these things I'm talking about, you all have them. You are well positioned to demonstrate them. You know, there is nobody here that does not meet any of these standards. It's just that you need to understand them and you need to demonstrate them when you're making your application. So let's look at the pathways to HCPC registration. It's fully online now and follows a strict sequence, okay? Previously, it wasn't fully online. So we used to send things through DHL and things like that to London. Right. So what you must prepare for Nigeria, you must have your BSc certificate, you must have your official transcripts, you must have your logbook, your NYC certificate. Sometimes they require this anyway. You must have your RRBN license. You must have work experience references, so they will contact your workplace. It's important that you, well, sometimes the workplace email that they usually require will be the one with the domain name that is not gmail.com. But if you find yourself in a situation where your workplace does not have this kind of email, where it is, let's say, uracare.org or, Reddington Hospital. Whatever. If it is not that kind of domain, then you may need to demonstrate to HCPC why your hospital does not have that kind of domain. Do you understand what I mean? For English language tests, you would have to perform well in any of these exams. And then, of course, you need your international passport. These are documents that you have to prepare. For the HCPC checks to evaluate your training, they are going to look at all of these indices, to see if you meet the professional standards. And of course, we surely do meet all of them, because these are all the things that we pass through in uni. These are the timelines. You have the assessment fee, which is often called the scrutiny fee. It is non-refundable, so once you pay it, it's gone. It takes roughly about 60 working days for the processing time. And then afterwards, you pay an additional £232 for the registration. So this is just a table to show you the steps that you need to follow. The first step is that you have to create an account. Set up an account. This is where the HCPC shows the portal access. So here you'll be able to look at, so when you create an account, you'll be able to see all the portals for international route and everything. You upload your documents, okay? You have to submit all the documents that they've asked you for in that website, and you check. What the HCPC will do is they will check for the completeness of it, and then it will be ready for assessment. When it is ready, after they've checked, they will ask you to pay for scrutiny, which is what we talked about. Then they will assign the assessors who do, they will check, the assessors will be the ones to assess all your documents, and they'll go through your file. The assessment period, what you're going to be doing is just to wait. There's nothing you're going to do. You just wait. And it takes that period of time. Like I said, it takes up to 60 days, working days, for them to make that decision. Then for verification, there's nothing you will do as well. You just keep waiting. What HCPC will do is that they will contact the university. Your university, my university, University of Nigeria, they already have like templates, and they know what HCPC usually ask for when they contact them. I suppose some other universities do, but it's important that you keep in touch with your university, especially with the departments, your HOD or whoever the secretary is, to let them know that HCPC might be contacting them. And they will contact your institution, they will ask for some documents. There's a certificate of good standing from ARN. There is also another letter that they require from the uni. So you make sure that you are in touch. It is your job to make sure that you're in touch with your uni, to let them know that HCPC will be contacting them. Sometimes they contact RRBN as well, just to verify your document from RRBN. RRBN also knows to respond to them. the time they usually respond, at the point they usually contact RBN, you would have done your NYSC and completed your, your program with NYSC, and so you are now fully registered. I mean, you finished your internship as well, so you're now fully registered. So as a fully fledged registered radiographer with the RRBN can then say to HCPC that they recognize you as a radiographer in Nigeria. Now, remember, HCPC is equivalent of RRBN in Nigeria. I mean, RRBN is equivalent to HCPC in Nigeria. Okay, so they will be having that conversation with RRBN as well, just to make sure that you exist. Then, when the decision is being made, they will either approve it or they'll ask you to take a test of competence. Now, a test of competence is when you have gaps in your assessment, or there are issues that they are not comfortable with. They will have gone through all of those to see that, if you're not really as competent as they deem you to be for some reason, then they will ask you to take a test of competence. And the final reason or outcome would be to refuse. So it's either you are approved, or you're asked to take a test of competence, or you are refused. Refusal is usually very rare, except somebody has done something really grievous. I know a radiographer who forged his NYSC certificate using somebody else's certificate. No, using somebody else's NYSC registration. I'm mixing it up. He forged his NYSC certificate using somebody else's license and document. Okay, and that individual that they used his license could not go for NYSC because somebody else has used. So think about it like identity theft, and so it was a legal issue. The police was involved. This radiographer was arrested from his place of work, and then he decided to register for HCPC to run away from Nigeria. And RRBN was on the know as well. So when they contacted RRBN, RRBN then told HCPC that that individual could not be registered because of character issues. Then you pay your registration fee when they come back to you. Immediately you pay your fees, you are registered automatically. So that's the last payment. And then practice is when you get the job. Are we all together to this point? Can I get a thumbs up? Thank you. And I hope you're not bored so far. All right, I'm going to now rush through a couple of slides. So this is what you need to know. I mean, the information is out there, but I just thought to put it out there. This is the website for HCPC. When you go there, and you look for the route for international. It's important that you go to HCPC website so you can also see for yourself what those standards are. You check your registration status. That's why you see your registration status, standard of proficiency, test of competence information, online application portal. That's where you see all of those. Okay, so this is for HCPC. What happens then after HCPC? You can work either as any of these written out here. Okay, you are now registered as a radiographer to practice in the UK. You can apply for any of these jobs you're seeing here, any of them, anything radiography related, except some specialized ones like ultrasound or reporting. You will not actually be able to get those kind of jobs unless you have like another postgraduate training. Like I said, in the UK, they've changed for sonographers, they've changed the pathway. You now must have case accreditation. So if you're interested in sonography, your best bet will be to apply for a job as a diagnostic radiographer, that's X-ray, come into the UK, and then find your way to top up your qualification by going for PGD ultrasound in the UK. to get a case accreditation for ultrasound practice, and then you can begin to apply for ultrasound jobs. You can come to the UK to practice straight up as MRI or CT radiographer. You do not need any special training, even though CT and MRI PGD or PGC, they are at an advantage. It just gives you a background, you know, an understanding of what MRI and CT practice, or, you know, the principles, what it is like. But most hospitals will definitely train you in any of those modalities. General radiographer is the same as diagnostic radiographer. Theater or fluoro is just like the name has mentioned. You do a lot of theater. Most of the time, these guys are rotation. They're called rotational radiographers. So they do theater, fluoro, CT, X-ray. They don't do MRI. In most places, it's either you do MRI and CT, or just MRI, or just CT with diagnostic, or with theater, fluoro, options. But it is very rare to find MRI radiographer doing the other bits. It is very, very rare because it's considered very specialized. Then you have the A&E. So again, some hospitals have A&E and trauma radiographer as specialized, but in most places they are part of general, so they are rotational. Okay, so banding in the UK is just like, you know, the level of entry. So band 5 is the very basic band. That's the beginning for any of the roles. Some roles start from band 5. Most MRI start from band 6. But the bands also reflect the salary. So you can check that online to see what the bands are. For postgraduate training, some hospitals would provide this training for you. They will train you or pay for your training. Rarely do we see people training by themselves or paying for the training. And that's one good thing about the NHS. The NHS is well funded to provide training for their radiographers. Okay, and then you can go into specialized or advanced practice pathways. You can become a reporting radiographer if you wanted. You can even own your own clinic. My class rep has his clinic now in London, where he performs head and neck ultrasound. Actually, two clinics. Right, let's go down. So when I talked about the test of competence, let's hope that none of you will have to go through test of competence. But if you have to go through test of competence, this is what it looks like. You know, it's just to verify your clinical competence, and it's becoming increasingly common with Nigerian trained radiographers, especially when there are gaps in CT and MRI exposures or governance framework or UK specific practice expectation. So if you demonstrate evidence that you have understanding of those standards, you remember the standards I mentioned, the 3 standards. If you demonstrate strong evidence of those standards, you will not find yourself writing any of these competencies. Because I mean, it is the same radiography that all of us studied, right? So you should be able to demonstrate. They are not asking if you qualified as a radiographer. They are now asking about those standards. That's why you're taking test of competence. The test of competence is a 2-part assessment. It is designed to confirm that your knowledge, clinical reasoning, and professional judgment meets the UK standard. Okay, so it's an online exam. It takes 90 to 120 minutes. And these are the things that they cover. There's also structured clinical assessment, where they look at these scenarios. I don't think I've seen anybody who has done this test of competence. But when they come back to ask for this, it will usually be for you to present your logbooks, you know, to show that you have demonstrated understanding of this. And so don't throw away your logbooks. You remember your logbooks from university, keep them. If you fail the test, you can retake the assessment. Okay, so HCPC will tell you which domain you need to improve. So that you failed a test of competence does not mean you can no longer register as a HCPC professional. Right. Okay. Great. So moving away a little bit from HCPC, let's talk about something interesting. You remember when I talked about the MSc, somebody asking if they could practice as a radiographer? So this is where we talk about it. There are other routes to come to the UK to practice as a radiographer, apart from being, apart from just graduating as a radiographer in Nigeria and registering for HCPC. There are actually there are only two ways, but the first two will require your HCPC registration. Then the other two does not really necessarily mean that you can practice radiography in the UK. So the first one is the pre-registration radiography. What we call pre-registration radiography is for those who want HCPC registration. Okay, it is not designed for radiographers. It is designed for people who are not radiographers, but who have science background. Somebody like who graduated from biochemistry, for instance, and wanting to practice in the UK as a radiographer. The UK tells them that they can practice as a radiographer only when they come through pre-registration route. So pre-registration radiography will have you studying as a radiographer. For 2 years. It's for those who want fresh UK registration and they want to avoid that HCPC. So you're going to practice. You're going to study for 2 years in selected universities. I think there are about 6 universities in the UK that offer that pre-registration. So within those 2 years, you will then attend clinical postings. They'll attach you to a hospital, okay, and you will register for HCPC after the 2 years. So it just takes 2 years for that person to become a radiographer. I mean, sometimes I feel like this is a slap to radiographers, but it is what it is. So they allow people who have science backgrounds. This is not, like I said, it is not for radiography graduates. It is for other graduates who have any medical science, not really medical science, but any science related courses background. Or if you have done the test of competence and you failed, then you can go through this pathway, but it is not in any way advisable. The path that says interventional radiographers whose BSc is not accepted by HCPC, the only reason your BSc is not going to be accepted is if you're not a radiographer. So, like I said, this is not really designed for radiographers. It is designed for other professionals who have medical science background. All right. Where am I? Right. So we have the post-registration. Remember, the first one was pre-registration. The second one is post-registration. It is for advanced practice. Okay. So post-registration is for radiographers. So you can decide if you, as a radiographer, the way you are now, you decide to do an MSc in the UK. It does not automatically mean you can practice in the UK. You still need HCPC registration for you to practice. But for you to then go into advanced practice in any of the specialized modalities, then you would have to do, advanced study. Most of the time, it can be MSc in reporting, MSc in nuclear medicine, or whatever. It takes about 1 year to 3 years. Some people just stop at PGD in CT and MRI rather than an MSc. If you wanted an MSc also or something like that, you could do it if you're also interested in going into academics, because you would need it for you to be able to apply as a lecturer to work here in the UK. But you still need your HCPC registration. Those are the first one that I mentioned, pre-registration, it differs from this one, which is post-registration. So if somebody who is not a radiographer decides to come and do MSc in MRI or MSc in nuclear medicine, the person cannot practice as a radiographer in the UK because they were never radiographers from their MSc, from their BSc. So the person has to go back to do this pre-registration for them to be accepted. Okay, so number 3, this one is just, for people interested in research and clinical education and leadership. It does not really apply for HCPC. Because our conversation has only been limited to the United Kingdom, I only prepared us for HCPC, but also we have the other pathways for other countries, and I'm not sure if Chijioke wants me to talk about them, but I just highlighted them briefly. There are other international routes. Are we happy to talk about them, or do you want me to? They're not really a lot. It's just a summary of those.
Yes, we can. Yes, we can.
Are you sure? Right. Great. For people interested in the United States, it is the most difficult pathway to go through. I was in the US last year in June, and one of my main reasons was to see what radiography practice looked like in the US. And I can tell you, it is not as excellent. I mean, when it comes to the professional outlook, the Europe, Canada and Australia, they have better outlook in terms of the regard and respect that they have for radiographers. So the US has a system where they use a lot of techs, and techs, when I mean techs, they are technicians. So this is different from technologists. So the terminology for radiographers that is obtainable in the UK, Nigeria, Australia, and Canada is different from the terminology in the US. They call their radiographers technologists. And then the lower bands, who are like apprentices, they call them technicians. Now, they assume that everybody practicing radiography in the UK, US, are all technicians, but they are not technicians. So you see radiographers fighting for their rights, always fighting to be recognized, always, so there is no such structure like you have in the UK. But it is rewarding, which is the other interesting thing. So you need to decide what you want, if you want the respect or if you want the money. So if you want the money, you can work towards any of this. You have to go through their website, but it is usually through the ARRT pathway. They will check for eligibility via foreign credential evaluation. Then you have to take a state licensing. So the state licensure is just to say, if you're going to California, for instance, the license that you use to practice in California will not be the same license that you use to practice in New York. So the license varies by state. Unlike HCPC, where you can use your license in London and still use it in Newcastle, it doesn't matter where you are in the UK, you can use it anywhere. Okay. Then you go through the credential evaluation, you prepare for ARRT exam, and then some states will require additional jurisprudence exam, which will mean that you're not just writing the ARRT exam, you also, the state licensing board will ask for another exam. So this is just to make you aware that this pathway exists. You can explore it. We are not going into the details today. Then there is Canada. A lot of you may have colleagues who are already in Canada. It is a less stressful pathway than the US, but you know your geography. If you do, Canada is next to United States in the map, and they are almost similar in the way that they practice, but they have more regard, more respect, more value for those in Canada than the people in the United States. The process of licensure is also the same in Canada in terms of state licensing. So they still expect you to have state license rather than the national license. So you couldn't use one license to practice in different places. So Ontario will have a provincial registration different from Alberta or British Columbia, etc. And if you wanted to know more, then please go to CAMRT website and you will understand the pathway for Canada. For Australia, where my sister recently moved to, she's not a radiographer, she's a physiotherapist, but we also share the same sort of pathway. So it will be similar in terms of what they expect radiographers to do. So the body that regulates the practice is Australian Health Practitioner Regulation Agency, and they use Australian Society of Medical Imaging and Radiation Therapy for skill assessment. Okay, so there are two bodies. First one is the regulatory body. Second one is skill assessment body. Okay. This is one of the most structured, transparent, and respected international routes. I will agree with this because I know colleagues who have also tried this pathway. They are very open and honest in their conversation. You feel like you are part of what the registration pathway and the flow. They are very quick in responding to you, but you need to, first of all, you need to go to the website that grants the registration, which is AHPR, and look at the assessment for migration. So when you go to AHPR website, they will show you pathways to register. But before you register, they will ask you to take an assessment. So the assessment test is not like a clinical exam or anything. It's just to know your situation. They will ask you which school you finished from, what country you are, do you work anywhere else? For instance, if you work in the UK, there is another pathway that they will show you to go through. So it's really structured based on your responses here in this assessment. Then they will tell you what next line of action is. Okay. This is still for Australia. So these are all the things that they need from you. These are all the documents they need from you. At some point, they want you to have English language tests. So this is occupational English tests here. They expect you to have at least a B in all the components. There's IELTS. So based on that assessment, remember the assessment I mentioned, they can ask you to take either this or that. So these are documents that you need to provide. So now finally we got to the end. So that is all we have today in terms of the countries that I can recommend. I'm not going to ask you to go to Republic of Iran. All right, so thank you very much. If you've got any questions, I would like to take now.
All right. Thank you very much, sir, for an insightful presentation. I mean, this serves both as enlightenment and also, I mean, the beginning part about ethics also serves like a pre-interview prep up. Thank you very much for that wonderful section. So do we have a question? You can unmute and ask your question, or you can type in your question on the chat. Okay, we have a question here. I don't know how you want to. Should I be reading out the question for you, sir?
Sorry, yes, can you hear me? Is that the one on the chat?
Yes, yes.
What about Germany? Is that the correct one I'm saying? Right. I do not have the information for Germany, unfortunately, but it's something that can be researched. I only limited our conversation to these places I mentioned and the UK. But Germany, obviously, I would only say that you are bound to face language barrier. You'd be expected to learn German at some point, or know how to speak German. You have to be fluent in that language for you to practice there. It's important just to highlight that.
Okay, so I don't know. Do we have a question? Because I have how do you put okay.
How do you prove
Okay, I
that?
have a question. Okay, so
Okay, sorry, I was reading somebody else's question.
okay.
I'll come back to you, Stanley. How do you prove that you are good in radiography so you don't have to take the test of competence? Okay. So when you are submitting your application, you're going to be writing about yourself. You're going to be writing about your competence. So remember those three components I mentioned. You have to demonstrate them in that in your writing, in your supporting information. Your supporting information or supporting document should be strong enough to convince anybody who was assessing your documents that you have an understanding of clinical practice, good clinical practice in your field. And if they feel that you haven't really captured the areas that they really want, or that your documents are not enough to demonstrate that level of competency, then they will ask you to take a test of competence. Does that answer your question, Amarachi?
Okay,
Yes, yes, it
I
does.
think
Thank you so
Okay.
much.
I think
okay,
Stanley
so
was.
okay, I have a question I want to put out. I don't know.
Okay.
Should I go ahead? Yeah. So I think so one of the most silent questions that people are asking. I mean, it's now as if we're in the era of the camera CAMRT route. Everybody's pushing towards Canada. Everybody's pushing towards Korea. So there's this question that people are asking about job opportunities when one is fully licensed with HCPC, gets an HCPC licensure. How is the job prospect? I mean, there are a lot of opinions that UK is very flooded or oversaturated, and we also have the immigration policies that people are not actually really don't know really about. Can you like throw more light on job opportunities and prospects?
Yes. So it's interesting because, like I said, some of the things changed. A lot of things changed from 2024 onwards, and up until that time, it used to be very, very. It was more like the UK opened their arms so wide for international radiographers to come into the UK, not just radiographers, but other professionals. And if you follow immigration rules and immigration, journey so much, you would understand that the UK, there was a time, in fact, this is not the first time it's happening. There was a time many, many years ago, about 2004, the UK opened their doors for international radiographers and other professionals to come in because they were under what they called shortage occupational list. And the radiographers came in their numbers, and after a while, the minister or whoever at the time, they just said, you know what, we don't need immigrants anymore, blah, blah, blah. And they closed that chapter, they closed the door, and people were not allowed into the UK until again, they opened around 2008. And there was another rush of immigrants coming into the UK. That door closed eventually as well around 2010. Then in 2013, it also happened. They needed people and they opened their doors. So, and at every point in time when this happens, it will be a new name of a visa. So the visa that I came into the UK with was called Tier 2 visa. In fact, before the end of COVID, they changed the name of my visa to something else. It was a healthcare visa or something they call it now. I don't know what they call it anymore. So what I'm trying to say is, yes, it might look like there's a challenge at this point because the UK's immigration policies and laws and things like that are changing, but that does not mean that they have closed the doors to internationally trained radiographers, because as of 2 weeks or 3 weeks ago, I know about 3 radiographers who got a job in the UK. In fact, they are now in the UK. And so if people argue that the doors have closed, I would say it hasn't. Maybe it has narrowed, but it hasn't really closed. Okay. People are now exploring other countries as a result of what the UK's immigration policies, look like now. And I think that's why people are now gearing towards Canada and Australia, which is not a bad idea. If that is what you want at the end of the day, you have to define what you want as a person for you to be able to be guided properly. So, but is the door closed? It is not closed, but you have more. It's not just Nigerians applying for these jobs. You have people from India. You have people from all over the world. So, if we used to be 10 people applying for a job, now we are 100. So you have to increase your level of your quality of application, not just the number of applications, but the quality of your application. It needs to be really, really, really top notch for them to consider you now. Yeah. Okay, let me just take this question in the chat. If you want to practice as a radiotherapist in the UK, does a PGD in radiotherapy help, or you must go through the MSc route? This is a very good question. You don't necessarily have to go through an MSc route in the UK, but a PGD is, it can help because then you can demonstrate that you are practicing as a radiotherapist in Nigeria. When you then get a job, they will train you. They don't expect you to go have a master's or PGD in the UK first before you apply for that job, because it's a specialist role. It's not diagnostic, so it's not really. Yes, it's under HCPC, but it is now a different side of radiography. They provide treatment rather than diagnosis. So you will be trained by your employer, and they are the ones who are meant to train you either for PGD or for MSc. They shouldn't expect you to have all the T's crossed and the I's dotted before you practice in the UK. I know somebody who got a job as a nuclear medicine specialist. Actually, my classmate, she has then since moved to the US from the UK. So that is just to say that this is possible. That's my response to your question.
Good evening.
Hi, Joseph. Good evening. I hope you're good.
Yes, I'm good. Thank you for the wonderful presentation. Yeah, so in a situation where someone fails to renew their license at the time that has been scheduled to be renewed, does it mean that the person has to start a fresh registration if they really need the HCPC again? And then in a situation where maybe one is under pressure for CPD or updates or info, and then the person does not meet up with the CPD profile update, and then maybe for some reason, as a result, the person is withdrawn from the register, or maybe how can somebody that has not been really up to date with CPD be able to defend or avoid being removed from the register? Thank you.
Okay, thank you so much, Joseph. To answer your question, I'm just going to ask you, is this a fresh registrant or somebody who has had HCPC already?
Someone who has had HCPC already.
Okay, so if you miss the deadline, obviously you would have received a lot of reminders before that registration ended. The cycle is every 2 years, and if if you miss the first notification, there were like about 4 or 5 reminders until the last day. Now, you were expected to contact HCPC if you are not going to be able to meet up with the deadline. But even if you have passed through that period and you did not make your payment, HCPC still expects you to be open to them. Tell them what has happened. If you contact them, they're very responsive, and tell them, for whatever circumstance you did not meet up with the registration renewal of your registration. They will consider your option. They will consider you, and they will ask you to make the payment. But I think they might subject you to a bit of assessment again, a little bit of assessment. For CPD, it is very easy to demonstrate CPD. CPD does not really mean you have to go for conferences or for seminars or for classes or anything. What we are doing currently is regarded as CPD. You can write your reflection from this webinar that we're having today and say you attended a webinar that lasted for 2 hours, and this was the content of the webinar. And we talked about radiography, we talked about HCPC, we talked about standards of proficiency. This acts as a CPD. That's what they consider CPD. So CPD is anything that you do to gain additional knowledge that improves your practice. It can also be that you have read an article from a radiography journal or a website and you've written down your reflection. It has to be demonstrated because you have to write it down, okay? Unless you are receiving a certificate. And even if you receive a certificate, you still have to demonstrate the CPD by writing a reflection. So a reflection is just a summary of what you have learned. So if HCPC calls you, which is unfortunate because they randomly pick people for CPD, it's not everybody that they call for CPD. So if they call you for CPD, you should be ready to provide the documents that pertains to your CPD that you've done over time. And I'm not sure how many they usually, I think there are about 8 of 8, a colleague of mine passed through CPD. I've not had to pass through CPD audit, but the audit that required to pass, there is a website, there is a portal in HCP's website where they talk about their CPD's audit. So you will see the guidance on how your CPD should look. So it is not to say that you're not going to get registered again. You will be registered again, but you need to keep the conversation open to them. I will recommend that you call them and say, this has happened. They will usually direct you to somebody or assign you to a member of staff who can help. I hope that helps.
Yes, thank you so much.
You're welcome, Joseph. Do we have any other question?
Do you have any other question?
Compare the pay among different countries you mentioned. I'm so sorry, Chizo, but this is outside of our conversation today, really. But you might have to really check that out online. But we are not talking about the salaries or comparison for the payments. So sorry, we're not going to be talking about it today. You're welcome.
All right. Do we still have any other question? All right. So I think we're taking the silence to mean there is no other question. Um, so once again, Mr. Nemeka, thank you very much for today's section. And before I conclude this vote of thanks, I would like to show something. Let me see if I can share my screen. Enter screen window. I think I can. Alright. Alright. So this it's actually the program track and progress. Although the only thing we've modified here is the tech and the AI skills in medical imaging, which is going to kick off in June because of the availability of resource people. However, the rest of the track still continues this way. So we're actually currently in phase two. So phase two is the requirements, getting familiar with the applications and the rest for every track, for the scholarship, for the global work pathway, for the fellowship, and for the research and publication. And this is our second section on on global work pathway. We've done Coral in the past, and this is HCPC intertwined with Australia, intertwined with Comrades, yeah, and we intertwined with I think AAROT for US. And we can't thank you enough, Mr. Nemeka, for putting all these things together. We also wanted to also let us know that the phase three, which would dated to kick off in June, will be the trial and application phase. Because the goal of this is not just to organize webinars and come together. We want to be able to have an ample results and at the end of this, right? I mean, it's the result that determines the continuity of this professional development program. So if as the section is going on, if you're already in the global um, pathway track, if you have any inclination to for these applications, whether be it Canberra, be it Koru, be it HCPC, I would advise that you start getting your documents together. This session is recorded, and very soon, I think by next week, we should have it up and running on our YouTube. So we'll share the link. You can go over it again, get your applications ready, and yes, for the try and application phase, whereby we actually be trying out these opportunities. Then again, Mr. Nemeka, I know you're a very busy person. In fact, to tell you the truth, when I reached out to you, I was not really expecting a yes, right? It was just me trying to try my luck. And thank you very much that we did not even have like push and shove back and forth. It shows like the passion you have for us young videographers that are still trying to find our feet in the profession. We don't take it for granted at all. And I also wanted to ask, is it possible during trial and application phase that people that are interested in, say, HCPC or people that already have, we have people that with their license on the call, but they need one or two pointers, probably, job openings or help in looking at documents. I know it's going to be a lot on you, but like to have like up to like three people that if they declare interest in applying, that you can closely work with to at least to get the licensure.
Yeah, thank you for asking. Quickly, I am a product of mentorship and I take this passionately. So, when you asked me to be here, I did not ask you any questions. I just said yes. So it's because I am a product of mentorship. I wouldn't be here if I wasn't mentored by others. So I'm more than happy to support anybody. But of course, like you already said it, I am super busy. I may not be responsive at all times, but I must respond. But I'm very much happy to support.
Okay. Thank you very much, Mr. Emeka. Thank you. We can't thank you enough. We can't thank you enough. So ladies and gentlemen, I think the boy is on our court now. Uh, to do the needful. And once again, thank you again, Mr. Nemeka, and thank everyone that was able to join on this call up to this very end. I mean, we're at 20 something now, we're at I think about 16 or 15. I mean, it takes a whole lot of tenacity to stay for a program from the beginning to the end, and we don't take it for granted. So we're still going to see if we can, when talk to see if we can have a section for rats, especially the whole exam preparation and all. So we're still in talk. If we succeed on that talk, we would also let us know on our WhatsApp group. And yes, so in the meantime, thank you everyone again for coming, and we wish you best of luck even as we enter the next phase of this program. And we said you